Okay, so by far the most common response to why aren't you in therapy if you want to go to therapy was cost. So I wanted to take some time to break down how do I use my insurance for therapy? How do I know what my insurance covers? The therapist I want doesn't take my insurance. How do we situate that? What am I supposed to say to the therapist? How do I talk to the insurance company? That's what we're going to cover today. Okay, so for simplicity's sake, I'm going to look at two different insurance coverage plans. So we're going to look at United Healthcare and Aetna. Before we cover either one of those, I just want to throw you into this space for right now. This is not a sponsored post. I don't have any affiliation except that I am one of the providers for Headway. But systems like Headway, Alma is another one. Headway is the one that I went with just because they cover a couple more insurances that I wanted to cover. So I went with them. I really enjoy the platform and how it works as a provider. But if you are looking for healthcare, third party places like these are really good. Also, Headway doesn't sell your info. So that's another, I asked that before I signed up with them. So when you go to Headway, this is essentially going to try and connect you with telehealth or in-person therapists that accept your insurance. So location, where do you live? They don't cover all states, but they cover quite a few. They have these under here coming soon. Right now they cover, what is that? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 17 states. So if you live in any of these states, which majority of my audience does, we're looking at, let's look at Illinois. Okay, let's say you're in Illinois and you want to find a therapist. Concerns, what can we help with? You can fill these out or you can hit I'll share later. But let's say I'm in Illinois and I want ADHD, but also I would really like to talk about ADHD related to maternal mental health and postpartum care and how that intersects in my life, right? We hit save, insurance carrier. They will suggest these of hey, here are a lot of the ones we see in Illinois, but here are all of the insurances that they work with in Illinois. So you can go ahead and pick yours. So let's just randomly pick Blue Cross Blue Shield and then click find care. And then you're going to get a list of people who accept Blue Cross Blue Shield, who address ADHD, who specialize in ADHD and maternal mental health, right? They'll also give you, here they give you kind of a snapshot, which is great. The things that I look for in a therapist is going to be different than the things that you look for in a therapist. Pronouns to me are really important. So that's helpful. This chair indicates in-person visits. This camera indicates telehealth visits. And then you can go down and look through. Psychiatric nurse practitioner would be great if I was looking for medication, right? Within Headway, you can be referred, your clinician can refer you from the system to someone who takes your insurance that can prescribe medication. Psychiatric nurse practitioners have the ability to write prescriptions under the supervision of a doctor. Licensed clinical social workers, licensed professional counselors, licensed mental health counselors, and licensed marriage and family therapists are not able to write prescriptions. So those are kind of two distinguishing things that you're going to look for. And then when you go in and you look at a provider's profile, I love this because you can just throw in a quick phone consultation. When can you meet? Right? This is a little bit more about that provider, gives them a little bit more information, gives you a little bit more information about them. This is their out-of-pocket cost. And then you can even go in and, okay, I want to add my insurance. Let me go ahead and add my information in here. Headway can verify it for you. You'd be the go-between between you and your therapist and your insurance, which makes it really, really nice. The other way that you could find a provider is by going to your insurance. If you don't already have a login for your insurance plan, all of the insurances do. So you need to have one. You can log in. You can even call your insurance company if you don't already have one to find out how to get one. But you'll go in and you'll look at find a doctor, typically. Now we know if we're looking for a therapist, we're not looking for a doctor necessarily, right? We're looking for folks that are within our coverage that provide mental health. A lot of insurance companies now will put mental health providers separately, right, from doctors as soon as you click on that, help me find a physician. So you can go under here and then you can look under any of these types of plans. Let's just go under state exchanges. So let me know. State exchanges are under the Covered California. For us, it's Covered California, but under the Affordable Health Care Act is the state-run version of that. So if I'm shopping around for the UHC plans, let's just say I'm doing this for myself. And let's say that, again, we're in Illinois. Okay, we'll look at that. And then this will give you what's available. Of course, it's going to do from Redlands, but it'll give you who's available. If you need a psychologist, if you need a therapist, If you need, like, what are the kinds of treatment that you need? What kind of care am I looking for? Let's say virtual care. And then we want to go within a lot more, but these are in-network providers accepting patients. This is a master's level clinician. Here's a PhD level clinician. Here's a master's level clinician who's an in-network provider. You also want to pay attention to these ratings, right? That's really important as well. But that's how you would go about finding one that's covered for your insurance. And then you make the phone call here, right, to set up, or you could even look at the website if they provide a website and see if you can book a free, like, 15-minute consultation. A lot of therapists will do that. Some don't, and that's okay, but a lot do. Then we'll go to, here's Aetna. Here's another example, right? So we'll go to individuals. We're trying to find a doctor. We're trying to find a therapist, right? Another place that I like to go to be able to, I'm part of this network, but again, this is not sponsored. I pay for this membership. These are therapists near you that are inclusive. So these are going to be folks who intentionally, these people are vetted when they want to come in and sign up to be a therapist that's part of Inclusive Therapists. You have to be vetted through their people, through their system. So let's see. This is especially for people who are part of minority groups who may have a little bit of hesitancy reaching out to a provider, not knowing what their stance is, or not knowing what kind of inner work that they're doing, or professional work that they're doing, if they're not doing anti-racist work, if they're not doing, feminist type work, if they're not doing, like, so if it's important. So we'll go here. Let's say spiritual knowledge is important, right? Let's say you want somebody who understands Mormon background, right? Mormonism. And then let's just say we'll put them in my zip code in California. Search now, and you can, again, you can decide all of the kinds of options. Oh, that's me. So I'm one that comes up. So then when you go and you look at a therapist profile, when you look at my profile, I have options available, like I have availability. And then you can look at if they're active in the community. Like I have a blog post, I have a couple of events that are posted, but you get more of a feel for who they are, and you can look at what they provide for services, what they provide specialty wise, what their therapeutic approach is. If that's important to you, you can also click on these, and these all have definitions of what this is, and then what their focuses are. One thing that I will say is when you look for specialties, this should not be like fully, like I would even say mine's a little bit long, right? I would not look for someone who says or therapeutic approach. If they have 20 listed under here, you've got to have somebody who's that's a generalist. You want somebody who's aware of specific things. It's good to specialize because then that's what they will hone in on. That's important. You can look at their education. You can look at their website. You can also look at how long they've been in service, rates. And then insurance as well. You can look at insurance as well. Okay, I'm really excited to show you this space. This is Open Path Psychotherapy Collective. This is not sponsored either. I just really enjoy sharing these resources with folks to make mental health more accessible, mental health care more accessible. This is for folks who either have a deductible that's way too high, so they would have to pay out of pocket for therapy, and that's not something that they can do right now, or for folks who can't afford out of pocket and don't have insurance. This is a nonprofit that allows therapists to provide affordable in-office and online psychotherapy sessions between $40 and $70, and then $30 for student intern sessions. So this is where therapists come to sign up to have sliding scale spaces so that you can go and find them in a collective. What we mean when we talk about sliding scale is if you can't afford full fee, a lot of therapists will have a certain number of sliding scale spaces within their practice or within their clinical work. So for me, any given time I have 5 sessions available for sliding scale. Most of the time, those are income based on an honor system. Some therapy practices will ask for proof of income. I have not encountered that even when I had to utilize that as a client. But this is where therapists have come and said, yes, put me in here. I have spaces for sliding scale clients. I want to be able to provide this to people. So when you go in to find a therapist, let's just say we're looking in Chicago. We'll go with Illinois again. You'll go in. I particularly like going with Open Path Collective because a lot of people feel awkward about calling and being like, hey, I can't pay full fee. Can you do sliding scale? When you call these folks, what you can say is, hey, like, let's say we call Lavoris Lee. Shout out to Lavoris Lee, LMSW, social work in Chicago. This dude would be the one to go to, right? So when we go in here, open path cost per session, we're individual counseling. He's available to charge anywhere between $40 to $70 a session, probably income based. He's accepting new clients. Online therapy is available, and he's open path verified. Open path verified means that they've been vetted at the highest level by open path's administrative staff. So those are amazing. Like that's like an extra, like, yes, do it. He's a newer practitioner, which I love because it's like straight out of getting licensed. Like that's amazing. Like go with that because he's going to be fresh and up to date on what's going on. He's going to be up to date on like cutting edge. When we go and we say, okay, I like this therapist, I want to go with him, right? You go to join OpenPath. And when you register for OpenPath, you fill out all of your information. This is also for nonprofit. You give like proof of income, like more information about what your income is. And you can also do right here if like, I'm going to be honest with you. If you're not comfortable filling some of these things out, don't fill them out. Right. I love that this is a nonprofit and that it's situated itself in a way. But also we have to recognize like privilege and also like the dignity that comes with not disclosing things that you don't want to disclose. So that's okay as well. You can go in here and put the name of the therapist that you've picked. You can also, you go in here and let them know, like, I want to do couples therapy, I want to do individual, or I want to do group. And you agree to paying this amount. I cannot afford the current market rates of psychotherapy, which is between $100 and $250 a session, which is wild that it's $150 of difference. And then I agree to not take advantage of this service, right? This is like to weed out people on our system. And then you fill it out. Next up, you pay a one-time membership fee to OpenPath. That's how they keep the nonprofit running, of $65. And then you have an ID where you're able to communicate with your therapist to talk with them about moving forward with services.